Hello everyone, welcome back to NEC channel. It's me again, Zulfikar. At the moment, as usual, I would like to share with you more about English for nurses. So, you'd better get ready. So today I would like to talk about nursing presentation. Nurses are educators within healthcare system. Nursing is not just about dispensing medication or administering treatments. One of nursing roles is an educator. Nurses are also responsible for teaching people about preventing and managing medical conditions. By relaying information, nurses help people take control of their healthcare. Why is it so important? Because, for example, in hospital, patient's education is a significant part of a nurse's job. Education empowers patients to improve their health status. Prior to your nursing presentation, there are some preparations that you have to do. These are some points to keep in mind before you perform your nursing presentation. First, avoid using specific medical terminologies, especially when you speak to people with non-medical background. The reason is that they will have difficulty understanding or digesting the material that you deliver if you use medical terminology. Explain to them in the simplest way possible. Another thing to point out is that you have to understand the learning style of the audience. As some audience may prefer visual learning, so you have to prepare some props or audio-visual aids. Another thing is the interest of the audience. You can talk about a relevant health issue or their current health condition. That way, you will gain interest from them. Now, let's move on to presentation. I would like to break it down into 3 phases: opening, main activity, and closing. Now, I would like to talk about the first phase, opening. In opening phase, there are greeting and introducing yourself. In informal situation, you can say, Assalamualaikum, good morning. My honorable lecturer, Mr. Saifuddin, thank you for coming to my presentation today. It's such an honor to be here. Thank you for having me here. In formal situation, you can say, Assalamualaikum, good morning my honorable lecturer, Mr. Saifuddin. It's such an honor to be here. I'd like to say thank you for coming in my presentation. Good morning my honorable lecturer, Mr. Saifuddin. It's such an honor to be standing here. My gratitude for you for giving me an opportunity to present my presentation today. Next, introducing yourself. These are some useful expressions that you can say. I'd like to introduce myself. My name is Zulfikar. I am from Nursing Academy of PPNI. Today, I'd like to present you a health education about. The presentation is about. My presentation today is about. Next phase, main activity. The first step of main activity is lead in. During this time, you can identify your audience's understanding about a topic that you deliver by asking them simple questions, such as, ladies and gentlemen, have you ever heard of dengue hemorrhagic fever? Ladies and gentlemen, do you know about what is the cause of? This is also an opportunity for you to draw the attention of your audience and gain their interest. You can say attention-grabbing fact related to the topic that you're presenting. For example, COVID-19 is one of the biggest health problems today. Diabetes is becoming a major problem in Indonesia. According to the survey, 40% of children suffer from malnutrition in Indonesia. Next phase, presentation. I would like to break down the expressions according to the use of them. First, introducing topic. First of all, let's get to know about diabetes. By definition, diabetes is. The cause of diabetes is. Next, Adding points. This is a dangerous or life-threatening disease. First. Secondly, the most importantly, or the last but not least, besides that, other causes of diabetes are: remember, you have to maintain interaction with your audience by involving them in a discussion and ask them simple questions such as, do you know about other causes of diabetes? What should we do to prevent diabetes? Next, opinion. In my opinion, from my point of view, personally speaking. Next, presenting ideas and giving examples. For example, such as, according to experts, research has found that. Next, contrasting. Although, even though, despite, in spite of, despite the fact that, on the other hand, however, even so. Next, expressing result and reasons. As a result, has resulted in, consequently, therefore. Next, concluding. To sum up, in conclusions, all things considered, taking everything into conclusion, the last phase of your nursing presentation is closing activity. During this time, you can ask your audience for some feedback by giving them opportunity to ask you questions and evaluate their understanding about the material that you deliver. These are useful expressions that you can say. Do you have any questions? It's question time. You can ask me anything about this. Please feel free to ask me any questions. Now, tell me about the causes of diabetes. Now, would you tell me what you know about diabetes? That brings us all to the last step, closing. In informal situation, you can close your presentation by saying, that is all for my presentation. I hope this presentation is helpful for you. Thank you so much for your attention. Assalamualaikum warahmatullahi wabarakatuh. Or in formal situation, you can close it by saying, that is all the presentation from me. Thank you for your kindest attention. My apology if there's any mistake or a limitation. Any questions, advice, or suggestions are fully expected. Thank you. That sums up my presentation. I genuinely thank you for your kindest attention. Please excuse any mistake or limitation. Any questions or advice are fully appreciated in purpose of improving on the next presentation. Assalamualaikum warahmatullahi wabarakatuh. Now, let's have a listen to this example of nursing presentation. Assalamualaikum warahmatullahi wabarakatuh. Good morning, my honorable lecturer, Mr. Saifuddin, and my beloved friends. It's such an honor to be here. I would like to say thank you for coming to my presentation. Let me introduce myself. My name is Zulfikar from Nursing Academy of PPNI. Today, I would like to give a presentation about COVID-19, or also known as coronavirus. I'm certain that you have heard so much about coronavirus. Tell me what you know about coronavirus. What is the cause of this? Yes, that's correct. Coronavirus disease, or COVID-19, is an infectious disease caused by newly discovered coronavirus. In 2019, the coronavirus was first discovered in Wuhan province, China, which later caused worldwide pandemic. According to statistics of COVID-19 prevention, by March 2020, there have been 4,241 cases reported with 3,509 sufferers, or 82.74%, being hospitalized, 359 patients cured, or 8.47%, and 373 deaths, or 8.79%. In my opinion, coronavirus disease is becoming the biggest health problem today, specifically in Indonesia. First of all, let's get to know about COVID-19. COVID-19 is one of coronavirus family that infects respiratory cells. Consequently, it can cause illnesses such as the common cold, severe acute respiratory syndrome or SARS, and Middle East respiratory syndrome or MERS. The virus is transmitted through droplet from coughing or sneezing. It can be a life-threatening disease. First, the virus invades the respiratory system rapidly. Secondly, the transmission is unfortunately accelerated. And the most important of all is the fact that there's yet any vaccine for the virus. Do you know about signs and symptoms of COVID-19? The signs and symptoms of COVID-19 can include fever, cough, shortness of breath, or difficulty breathing. Besides those, some sufferers may experience tiredness, body aching, runny nose, or sore throat. Keep in mind that the symptoms can be mild or some sufferers do not show any symptoms at all or asymptomatic despite the viral infection occurs. What should we do to prevent COVID-19? This mnemonic can help you remember about COVID-19 preventions. 1. W for wash your hand. Wash your hand often with soap and water for at least 20 seconds, or use alcohol-based hand sanitizer that contains at least 60% of alcohol. U for use surgical mask if necessary. The point is that it will help you to avoid getting exposed or exposing the virus. H for have your temperature checked. Regular temperature checking can be helpful for early detection of the disease. A for avoid traveling and crowd. That means you are supposed to stay home from work, school, and public areas. N for never touch your eyes, nose, and mouth with your unwashed hands. These are the entry points of the transmission. Do not touch them with your unwashed hands. For instance, cover your nose or mouth when coughing or sneezing. In conclusion, COVID-19 is a pandemic disease with rising number of cases, particularly in Indonesia. From my point of view, we all should start taking precaution by performing prevention strategy mentioned above to overcome this whole issue. Please feel free to ask me any questions. That is all the presentation from me. Thank you for your kindest attention. My apology if there's any mistake or limitation. Any questions, advice, or suggestions are fully expected. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. That is all that I can share with you today. Thank you so much for listening. If you like this video, don't forget to click on like, subscribe, or share on your social media because there are going to be more videos like this. Happy learning and have a nice day.